And I think that is very important to establish which is the balance between the good and bad things induced by the sun, because also we want that the population gets the benefits by the sun. So Professor Lin is going to tell us this yin and yang of sun exposure.
Thank you very much, Yolanda. Thank you very much for inviting me to participate in the session and to come to the meeting. It's definitely a pleasure. So the topic that I'm going to cover, hopefully in the next 15 minutes or so, is this balance of sun exposure in terms of positive and negative effects of sun exposure. These next two slides are my disclosure slides, are all related to photodermatology projects. This has been mentioned before in terms of spectrum of sunlight reaching the surface of the Earth. You can see that UV is a relatively small portion of it, and almost 50% of visible light, and then the other 50% is infrared. Clearly, UV is the one that has been studied the most, but I think more knowledge are coming up now on the visible light. You can see the effect of UVB and UVA2 on the top line, erythema, photocarcinogenesis, especially in lighter skin individual, UVA1, which is the longest spectrum UVA, tanning, photoaging, it also contributes to photocarcinogenesis. And the new findings on visible light, it can induce erythema on all skin types, but as importantly, it can induce tanning response, which is quite intense and long-lasting, as Susan had shown before, on darker skin types individual. The next few slides are all very familiar to all of us. You can see the photoaging depending on the skin type. It shows very different photoaging changes. I want to highlight for Asian, on the 83-year-old there in the center, the flat seborrheic keratosis is quite common as part of the photoaging changes, just like some had proposed melasma to be a photoaging changes. Obviously, we all know about skin cancer that can develop, especially in a lighter skin individual. So what are the beneficial effects of sunlight? This is an area that has come up, has been around for quite some time, but there are more data coming up now. The data is still not definitive as yet, but they're enough. I think as scientists, as a physician, we need to be aware about this so that we can address patients' concern and questions appropriately. Let's take a look at what are the known beneficial effects of sunlight. Vitamin D synthesis is very well known throughout the medical school and residency day. We all know about this. Notice the action spectrum is in the UVB spectrum, and it requires very, very little, as Alberto had already mentioned, of UVB to induce vitamin D synthesis. But mental health, I think many of us know about it. We know when we go outdoor, we tend to have a more elevated mood. We tend to be more happy. There are a lot of publications on this. I'm highlighting some of the newer ones. Positive impact, about 11,000 Navy personnel. Positive association between sun exposure and mental health among almost 800 OR nurses. The study coming from China. And then looking at the other way, in terms of depression, what has been found is that this is a pretty nice study looking at 25,000 individuals who are depressed. They were 1 to 4 matched with controls. You can see the numbers are very, very large. Short-term and long-term exposure to pollutants and reduced duration of sunshine were related to increased risk of depression. So again, this is mood elevation and depression all related to sun exposure one way or the other. This new article, relatively new now in 2004, coming from Richard Weller Group, actually stimulated a lot of the discussion about this particular topic. Sun exposure, he highlighted there, reduced all-cause cardiovascular and cancer mortality, and I'll go over it in a little bit more. And multiple trials, all vitamin D supplements show little effect, little benefits. Sunlight has health benefits from vitamin D independent pathways. This is his opinion. Again, data is not completely strong, but it's something that we need to be aware of it. And this is taken from his article. One of the tables you can see on the top is beneficial of UV-induced mechanism, nitric oxide mobilization, immune regulation, vitamin D synthesis, inflammation, and gene homeostasis. And of course, there are areas that are still unknown and unexplored. I want to highlight the lower part here. This is a summary of many of the articles that have shown studies on this, on effect of UV in terms of benefits. Decrease all-cause mortality, decrease blood pressure, decreased cardiovascular disease, decreased type 2 diabetes, decrease in multiple sclerosis, MS, the data actually is quite good, decrease in COVID, cancer mortality, and of course rickets and vitamin D is very, very well established. Again, the data in some of them quite strong, in some is still not quite strong as yet, but nonetheless there are quite a number of studies out there to show this type of effect. Coming back to the second half of the same graph, being a dermatologist, Dr. Weller also stated the downside of UV-associated effect, which we all know, DNA damage, free radical generation, skin cancer, photoaging, and of course the development of photodermatosis. So this part we already know. Now, the same group also looked at, but late 2024 or so, published this article looking at the UV exposure and mortality from UK data bank cohort study. It's quite a large study, and therefore the data is quite interesting to analyze. They looked at over 500,000 participants in the UK data bank. Then they eliminated the non-white ancestry just to eliminate the effect of pigment on this effect of sunlight. So after eliminating some of the factors, they analyzed 360,000 participants for this effect. And the result is quite interesting. Let's start with the solarium use. This is essentially they separated the cohort that had been exposed to tanning beds. And you can see the middle vertical line is the number where to the right is increased risk, to the left is decreased risk. You can see if you look at all-cause cardiovascular disease, cancer, and non-cancer cardiovascular disease, cardiovascular risk, it is all decrease. There's a decrease. Now, if you look at the average annual resident shortwave radiation, the shortwave radiation meaning UVB and UVA exposures, again, he analyzed and separate out those people who live in a higher UV exposed area versus lower UV exposed area. Very similar finding. You see all the factors that he looked at, all the dots and the bars are on the left-hand side, meaning there is a decrease in the cardiovascular disease, all-cause mortality, and so on and so forth. So it is quite interesting and large data that he analyzed. Then he looked at melanoma and non-skin cancer, period. Starting from the left, if you look at melanoma, the circle is solarium use, the triangle is shortwave radiation. You could see on the left is the incidence. The incidence of in both group of patients, the melanoma, there's a slight increase, even though it's not statistically significant, but it's a trend of increase. But if you look at the mortality, which is the middle part of the graph, you could see that the mortality is exactly at the dotted line, which is at the 1 hazard ratio. Look at on the right-hand side, the skin cancer. You can see for skin cancer, non-skin cancer. So the non-skin cancer, the incidence for both groups is pretty much the same. That is at the expected range. But in terms of the mortality, there is a decrease for both groups, so solarium use as well as a shortwave radiation group. So beneficial effects of sunlight, just to summarize, it is positive for vitamin D. We all know that. Mental health, I think the data is quite strong, but there are other also multiple health status, including cancer and all-cause mortality, that may have beneficial effect of sunlight. Again, I want to highlight there are limitations in many of the study. Some of them require based on solar sunlight modeling. Some of the data may not be as large in terms of numbers, but still, there's enough noise out there that I think we all have to be aware of. This brings up then how should we advise our patients. We know the beneficial effect now that I have just mentioned. We also know throughout our training and our experience the negative effect of sunlight. So how do we advise patients in a balanced and realistic fashion? This is the important part. I think some of you had heard it from the previous speakers, that when we talk about photoprotection, sunscreen clearly is important, but it is not the only one. In fact, if this entire package is very, very important to be transmitted to our patients, as well as to the public. We all get exposed to media asks us questions. We have to emphasize to all that, the photo protection would include staying in the shade when outdoor. I want to emphasize that, we should not encourage people not to go outdoor. Everybody likes to be outdoor. We want to be able to enjoy life. But, my point is that if you go go outdoor, do sensible photo protection that includes staying in the shade, wearing appropriate clothing, long sleeve shirt, wearing white brim hats, wearing sunglasses, and only in the otherwise exposed area use sunscreen. So sunscreen should be relatively limited in terms of the usage on the exposed area only. Susan had highlighted the cost of using sunscreen also. The non-topical agent, you heard it quite a bit from Salvador Gonzalez. It is an evolving area. It is not to replace this entire package of photo protection, but it is potentially a good additive agent that we could use in advising our patients. In terms of sunscreen skin cancer, this is the best study still. It is quite old by now. It's first published in 1999. But this is a very long study of 4.5 years active phase and an 8-year follow-up. So a 12-year study of 1,600 individuals by Adele Green in Australia, showing that the regular use of sunscreen would decrease the skin cancer incidence rate in terms of squamous cell carcinoma. And basal cell carcinoma also decreased, even though it did not reach statistical significance in the study, probably because basal cell carcinoma, the evolution is longer, but nonetheless, there is a strong trend, and they look at melanoma, also showing a decrease in the rate of melanoma. Keeping in mind, this study was started in the 90s, so the sunscreen that they used was SPF 15. So think about it, if SPF 15 is helpful, then clearly, there's more beneficial of using even better sunscreen that we have now in 2025. You have heard about this before. UVA-1 and visible light would induce fairly significant immediate pigment darkening, as you can see on the very top, and the last square there showing a very persistent darkening a week later. Compare and contrast that with UVA-1 induced on the left-hand side, and which is not as intense, and compare with the visible light on the right-hand side. Skin type 2, you can see there is no alteration in visible light, and this is from a paper that was published in 2010. So by now it's quite a few years old, but nonetheless, it serves the basis for many of the studies on visible light. And the clinical implication of that is that visible light and UV1 has a role in the conditions aggravated by sun exposure, such as PIH and melasma. These are conditions that we all know tend to be more common in darker skin individual. It can induce erythema, this UV visible light plus UVA1. And the challenge here is that the organic sunscreen are not sufficient to protect the skin from effect of visible light, because in order to block visible light, topical agent would have to be visible. That way they can reflect the visible light, because right now there is nothing that can do that. That is the reason that tinted sunscreen that Susan had already mentioned, containing iron oxide, is currently still the best, at least for the US, is still the best, because we are limited in terms of type of UV filters available in the US. And this is another set of data that shows from a review article that we wrote in 2021, looking at iron oxide and titanium dioxide. Notice that titanium dioxide on the last one here is pigmentaries. Rather than nanonized, it is used as pigmentary titanium dioxide. This is to mix the color so that you can get the appropriate tint. Iron oxide comes in 3 different colors as shown there. And then on the lower part, it shows that why iron oxide works, because it does reflect visible light. That's the reason it is protective against visible light. But because of that, there are limitations of iron oxide. The color match is quite challenging. This is a study that we recently published. You can see that for the skin type 4 and skin type 5 is relatively okay. Not perfect, but relatively okay. This is universal tinted sunscreen that we use. Okay, it comes in different shade. We selected universal sunscreen, universal tinted sunscreen. But if you look at skin type 6, you can see it's a very, very noticeable whitish discoloration after the application. Clearly, this is not acceptable to our patients. So this is still one of the limitations of tinted sunscreen. The other one, as you all know, just like tinted makeup, it does stain clothing. It can be washed off, but nonetheless, it is quite messy to use. So those are some of the limitations for tinted sunscreen. European or have new filters, obviously, this is not available in the US, and both filters would cover visible light. You could see the top one is Maxtrail 400. This is available in commercial product in Europe. This is a L'Oreal product. The lower one is Triasorb. You can see that it has very long absorption over UVA, UVB as well as visible light. Because of that, this is somewhat yellowish in color. This is available in PFR product. So this leads to the idea and the concept of personalized photo protection. A number of us, many of us in the room here, had written about this particular topic. Susan had already covered it also. Photo protection advice has to be personalized and tailored depending on the age, depending on the skin type, depending on the outdoor activity, depending on the sports activity, depending where you live, depending on the pollution. Salvador showed a very heavy pollution, smoke in the very beginning, so you know about the pollution there, and of course the skin phototypes. And this slide, which we published in 2021, has been used by many in many photodermatology talk, specifically on skin photo protection. You can see depending on the skin color, from light to very dark, SPF 50 for the lighter skin type, SPF 30 for the darker skin type. UVA protection has to be very good, but especially important for darker skin type individual. The visible light photo protection, clearly we need to have visible light photo protection. Right now there is no agreed upon method for all the regulatory agencies to look at visible light photo protection. A number of us are doing a conference, a consensus conference on this particular topic right after the EADV in October in Amsterdam. So hopefully shortly thereafter we will have hopefully a paper published as to how the group of experts would recommend, including the industry participants in that, in terms of visible light photo protection method, because there's a great gap right now. Again, a lot of sunscreen, they claim that they have visible light photo protection, but exactly how they do it is not quite known yet. This would bring to this interaction of skin, of exposome, which is the external factor, microbiome, which I don't have a chance to talk about, skin and gut microbiome, and of course the genome, genetic, skin type, gender, and age. So these are all interacting in doing photo protection. So to summarize then, we know that the deleterious effect of sun exposure well known to all of us throughout our training, in our practice. They are new data now, some of them are not so new, but beneficial effects of sun exposure, including the benefits of outdoor activities that we all know. Data is still evolving on this, so I want to emphasize again that our photoprotective advice to patients and the public needs to be balanced and personalized. Lastly, in my role as president of ILDS, I want to invite all of you to come to the World Congress of Dermatology, which is going to occur in Guadalajara, Mexico. You have the picture right here of Jorge Ocampo and Maria Isadeo in the room, so I want you to stand up so that people could know. I know they all know you, but stand up, please, because they have worked very hard. They have traveled the world. Every week they're in different countries, but nonetheless, and I'm looking forward to a very, very successful meeting, and I'm sure you all are very, very welcome to come to Guadalajara to visit. Our board is going to be in Guadalajara in 2 weeks to do the site visit of the site, which I'm certain is going to be a successful one. With that, muchas gracias.